When admitting a patient, please ensure that the owner reads and signs the consent form and understands what the patient is coming for, including the anesthetic risks. The nurse needs to check that the patients have fasted for 6 to 8 hours, unless it's a juvenile, which means only 2 hours of fasting. When you admit a cat, always bring it from room to room in a enclosed carry cage. Never carry a cat in your arms. Always ensure that all doors and exits are shut for the safety of the cat. We would always have a large towel handy in case the cat is difficult to handle. Observe the cat from outside the cage to see whether you're able to let it out. In this case, I would bring the cat out and examine it. Always hold the cat first. Don't attempt to examine it straight away. Holding a cat close often comforts it and it makes it easier to handle. Always have a nurse who can handle a cat well. Handle it gently, always. Check its ears for any ear infection and treat accordingly. Check its eyes for any discharge. Check its mouth for the condition of its teeth and tongue and confirm its age. Check its lymph nodes. Turn it around. Check its abdomen to make sure that it's not pregnant. If it's pregnant, I would consider a midline approach instead of a flank spay. Check its heart in case it's got a heart murmur. If the cat is gentle enough, check its temperature to make sure it's not ill. If it's a feral cat, I would not attempt to check its temperature. I would proceed to pre-med it. I would always check the sex of the cat in case it's incorrect. Often owners would be mistaken about the sex of their pet. Always check all patients' weights in order to get the right dose for anesthetics and pre-med. With little cats and little dogs, I would use baby scales. They are far more accurate and it can be done in the privacy of a quiet room, away from the noise of a waiting room. After this, I would check the pre-med dose. In a clinic, you should always have pre-med dose charts and anesthetic dose charts handy on the wall, with dose rates written down for ranging from 1 kilogram to 20 kilograms or so, printed with correct dose rates for every drug that you would need. In this case, the cat is about 1.9, so I'm going to look up the dose rates and pre-med accordingly. Always use small syringes for small patients. Do not use large syringes for little animals. You could get it wrong. Give pre-meds subcutaneously for a gentle cat. For feral cats, I would do it intramuscularly for the safety of the vets and the nurses. After pre-medding, I would put it away in a quiet cage, always high, and let it rest for 10 minutes. Pre-meds would take about 10 minutes to work, so pre-med 10 minutes before surgery is due. With a feral cat, I would always do it through a crush cage. Cover the cage with a towel so that it can rest and not be frightened. The surgical nurse is preparing the theatre for surgery. She is bringing the surgical kit and the surgical drapes into the operating room. Notice that each kit is taped with an autoclave tape that has turned black, indicating the correct sterilization temperature has been reached. The nurse is preparing the drip and the drip line before the patient enters the room. Here she has the drip line entering and coiling around a bowl of hot water so that the fluids are warm before it goes into the patient. Hypothermia is the main cause of anesthetic complications. It's important to heat up the patient. Here we have a heating pan. Make sure that the heating pad is covered with a thick layer of towel so that you don't burn the patient. Once the surgery room is prepared, then bring the patient in. The leg is clipped for the IV drip. Make sure that the leg is sterilized aseptically, because it's going to go intravenously. Here we use alcohol. Always use a very fine IV catheter for a small animal, such as a 24 gauge catheter. Notice that the nurse is handling the cat very gently but firmly, just with her hands around its head, neck. Once it is in, the patient can be anesthetized. In this case, we do it intravenously. In feral cats, you can do it intramuscularly. The IV drip is hooked on for any procedure that is longer than 20 minutes. Or in very old or very young animals, it is important to put a drip on to maintain blood pressure to the vital organs. For flank spay, the cat is placed on its left-hand side for a right-hand flank spay approach. All patients should be intubated whether you put on gas or not. In cats that are prone to laryngeal paralysis, spray lignocaine, wait for 2 minutes before you intubate the cat. If you don't have a spray, use a drop of lignocaine onto the larynx. Intubate gently. Tie the string around its head. In a dog, you may tie it around the nose. You always check that the tube is in the right place, the trachea, by listening to the breath or by using a cotton ball and watching as the cat takes its breath. The nurse is checking its eye reflexes and jaw tone for the depth of anesthesia, and monitoring has to occur every 5 minutes minimum. The cuff is blown up with a small amount of air in the cat, about 1 or 2 mils. To locate the position of the incision, the landmarks are the greater trochanter and the wing of the ilium. Where they intersect, double the distance and make the incision 45 degrees. Clipping must be done with a clean, sharp pair of blades. Always lay the blades flat on the skin, not pointing down, otherwise you would cause clipper rash. Clipper rash is one of the most common causes of licking post-operatively. Vacuuming should be done to remove all traces of fur from the patient and surgical site. You can use a handheld vacuum, or in this case, central vacuum. Notice that the nurses are checking the anesthetic depth. In preparation of the surgical site, always wipe from the incision area and work outwards. Never ever work your way in. So start in the middle where the incision is and work outwards. The second prep is a spray of alcohol, 70%. And the third spray is chlorhexidine and alcohol. All that is written in the manual. While the surgeon is scrubbing his or her hands, the nurse is monitoring the anesthetic. She prepares the surgical kit. Notice that she touches the outer layer only. All kits, all drapes are double draped so that the nurses may handle the outer layer, leaving the inside layer sterile. She continues to monitor the patient by checking its eye reflexes and its withdrawal reflexes every few minutes. Once the cat is stable, the surgeon prepares